Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts. Healthline 3 is a 30-minute conversation where we like to focus on ways to help you live a healthier, happier, and pain-free life. We'll be taking your calls and answering any questions that you have live in the studio today. We'll be opening those phone lines in just a little bit, in about 5 minutes. But when you do call, make sure you're in a quiet room. And if you're tuning in on your TV, we ask that you turn your TV all the way down so that we can hear your question clearly. That number to call is 318-219-4569. It will also be on the bottom of your screen when those phone lines are open. And joining us for today's conversation is Dr. Alana Hofmann, transplant surgeon with Willis Knighton Health. Thanks for being here.
Thank you again for having me.
Absolutely. So I just got to talk with you a little bit in our midday newscast, and you've only been in Shreveport for about 3 months. So tell us a little bit about you and why you became a transplant surgeon and how you ended up here.
Yeah, so my entire career, I really wanted to do medicine. I didn't know exactly what I wanted to do. And I was from a kind of unfortunate area around East St. Louis. And when I grew up, I really held myself to try to kind of get out of our area the best we can and, pursue college. My parents were the first ones in our family to even go to college and be college graduates. So my sister and I really wanted to take it a step higher and go to grad school.
Love it.
So I got into an MD-BA program in Kansas City, Missouri. So I combined my college and medical experience together. So in 6 years, I earned both my BA and MD, and at that time realized that I really wanted to get into a career where I could immediately have an impact on someone's life.
Yeah.
And so I pursued general surgery, which took me down to Florida for a little bit. And I trained there in general surgery and really found the passion for transplant itself. I like the idea of being able to help a donor family give the gift of life and also have that immediate satisfaction of helping our recipients out and following them long term. These patients of ours, we're not like a typical general surgeon where we do surgery and we say goodbye. You're with us for life, and that is always fun. You get to see how their life evolves, what grandkids they have, everything that they weren't able to, they were told they may lose that early because of their disease process. And so I came here to Shreveport specifically to work with Dr. Zabari, because here I don't think the appreciation is here for Northwest Louisiana and exactly how big our transplant center is and how advanced we are here. And as someone who had the opportunity to interview around the entire country, Dr. Zabari holds a very important place in my heart for how far he's able to take this program and really develop it into things that other transplant centers can't offer, such as robotics.
Yeah. Wow, that's awesome, and so happy to have you here in the area because it's such a need, and your specific focus, though, you mentioned is in the abdominal area. So what organs does that impact?
So I'm an abdominal transplant surgeon. That includes kidney, liver, and pancreas. Now, some of those organs do get to come with two, a 2-for-1 deal. So the liver and the pancreas can come with a kidney as well. So we really try to help our recipients as much as we can to get them back on the right track. More specifically, I'm also a recovery surgeon, so it gets the cool part about it being transplant. Like I said, you get to do the recipient, you also get to do the donor and help out the donor family and give the gift of life. And with that is where one of my specialties are in normothermic regional perfusion, and that's kind of what I was able to give back to this community. Yeah,
and it's such a sensitive time in both patient's life. When you're working with the donor family, it's probably in some cases very emotional, and being that person that you get to just be a part of that process. I'm sure it's really emotional, but really special too to be a part of that.
It is. I have a very high respect for all of our donor families. I want to assure anyone who's out there that is an organ donor that we have the utmost respect, especially in the operating room, to make sure that, your gift is honored the best we can. And really, organ utilization is something that is in the government talk right now. It's something that's all over national news. And that is something that, as a transplant surgeon, we really want to be able to use every gift of life that's been given to us. And from a donor standpoint, it's really an amazing opportunity to be able to, of course, it's a sad situation for the families, but as long as I can honor them and keep the gift of what the donor wanted, that is the part that I get to keep in mind, and I get to keep and see how the recipient does. And that's something that is lifelong. Sometimes I love listening to some of the eulogies that's given by the organ procurement organization, and really go into really feeling like you knew who that donor was and you can understand why they're giving the gift of life.
Absolutely, yes. And so, transplants, it's something that maybe people don't really think about until you are in that situation, So you focus on the kidney, pancreas, and liver. So what kind of diseases do you see that kind of make someone to be on that transplant waiting list and then ultimately in your operating room?
The most common is kidney disease. So that's something that's been a growing epidemic here. Kidney disease can become from long-standing diabetes, long-standing hypertension. There's a subgroup of autoimmune conditions that can affect the kidney. You can have genetic components such as Alport's disease, which we are all, as community surgeons, we all see the effect. And once you're in, something to consider for our patients out there is that you do not need to wait until you're on dialysis. You can come, once your GFR is lowest than 20, talk with your nephrologist and your dialysis centers or anyone who's watching you, and know that you can have an early referral to a transplant center and allow us to begin the workup process for you. So you don't necessarily have to wait until you're on dialysis. We do preemptive kidneys transplants. For liver disease is kind of going through the roof, and we don't know why. There's a lot of disease processes such as alcoholic liver disease that we go ahead and transplant for, but we also do non-alcoholic fatty liver disease, which is now multiple terms including MASH, MALD, whatever you want to name it. There's also genetic components like NO1 alpha trypsin deficiencies, all these things. So anyone who's following with a gastroenterologist who knows that they have liver disease, here's the terms that they may have cirrhosis, may have a decompensation. So these are patients that have some kind of confusion and concerns that they may have hepatic encephalopathy, they may have fluid around their lungs that they have to be tapped quite often, may have fluid on their belly. These are the patients that really do benefit coming to a transplant center.
Yes, well, very interesting information, and lots of things for you to have to keep up with too. So first we have our first caller, Candace. Thanks for joining us, and what is your question for Dr. Hofmann today?
Thanks for joining.
Hi, Candace, can you hear us? Candace? Oh gosh, we might have lost her. Candace, if you still hear us, give us a call back at 318-219-4569. We'd love to hear your question. And if you're just joining us, those phone lines are now open, and you can give us a call. That phone number is on your screen. It will be up until those phone lines are closed, and we would love to hear from you. We're talking specifically about transplant surgery. So we have a transplant surgeon with us today talking about kidney, liver, and pancreas transplants. So if you have a specific question regarding that, you can give us a call. So, okay, going back to kidney disease, liver disease, those are probably more common. And now pancreas, what would be a reason why someone would come to see you or be on the wait list for that?
Definitely. So pancreas is one of those that if you have any type of diabetes, so it used to just be type 1 diabetes, that we would offer pancreas transplants for, but with recent growing expansions with our nephrologists, I mean, they really keep up to date with everything. We have now been able to expand to type 2 diabetes as well. Nice. For those who require insulin, to try to give them an opportunity to come off of insulin. Sometimes it's not perfect, but the quality of graft that you can get with a kidney and a pancreas at the same time is a little bit different than just doing kidney alone.
Interesting, yeah. And so, and one thing that maybe viewers or people don't realize is there is a connection between diabetes and kidney disease. So you can kind of talk about that connection there.
Yeah, so over time, diabetes really affects those end-stage organs. So you're talking about your eyes, so people can have difficulty with vision with their eyes. They can have kidney disease where they develop a nephropathy and eventually end up on end-stage renal disease. And then you can have the damage to the nerves, both in the hands and the feet. So there's a lot of areas where diabetes plays a key role, especially even on cardiac surgery and with the heart. It's just a widespread disease. So when it does come down to affecting the kidney, that is when we want to consider if we can do a kidney and a pancreas transplant at the same time. And the reason being is that pancreas can serve as a protection to the transplant kidney so that the transplant kidney does not get diseased again with diabetic nephropathy.
Yeah, that's something that, that maybe people that don't realize that, like you said, that if you have a low GFR and, if you're seeing your primary care or your nephrologist and they're telling you this is something that you could just have a conversation with someone like a transplant surgeon, right? And you can just start that process. So you're not, at end stage disease and still on the wait list waiting.
Correct. The kidney and pancreas recipients are typically a little bit younger, so these can be like as young as 18 and above that have had type 2 diabetes, that had early effects on the kidney. And those are kind of the population that we aim for when we do the dual organs.
Right. Okay. And do you happen to know how long people, or like what the wait list waiting time typically is, like the average wait time on the wait list?
So
for the transplant list.
Average wait time across America, when you say kidney, pancreas is one of those that it comes in waves. So either you have a lot of patients, because the pancreas donor specifically is actually a very tight population. So there's not as many pancreas donors that are available in the country, and especially with the growing kind of epidemic of all of our medical comorbidities across America, pancreas donors are kind of far and few in between. The average for a kidney transplant wait list is usually quoted about 8 years, but there's difference with that in stuff that we're expanding in our own institution. So what used to be that you kind of go from the top of the list down, that is what we do. But it's also about being able to do organ utilization and really finding and matching donors with our recipients. And that's the thing that we want to give to the Northwest Louisiana community, is we're going to continue to grow our wait list. So the big things and the kind of shift in paradigm that we've had at Willis-Knighton is that with the addition of Dr. Choi and Dr. Crane, my partners, who are amazing human beings as well, they already started this prior to me being here, and I just get to add on to it, is before our institution used to have like a BMI cutoff, or what your weight versus height ratio was, and we've kind of did away with that for now. We're working and building a center with our metabolic team and our bariatric team to be able to really work well with the people who are overweight, so that we can work at just getting generalized better health for these patients, so that even though we give them the organ and they can come off of dialysis, you do have to treat it like a new life, like a baby. You have to kind of keep it growing. You have to try to keep it from any type of illness. And these are the things that we really want to focus with our patients wholeheartedly, is that it's not just about the transplant. We want to see that you have a long and successful longevity of life with the new organ. So we focus on the whole human. So we take care of their blood pressure, your sugars after transplant, any comorbidities that you came with. We make sure that we can optimize it the best we can.
Yeah, that's a great point, that you're getting this new organ, so you want to take care of it and not end up back where you are, because these chronic diseases, it's not like it's something that obviously has happened over time, and when you're given this new organ, you want to make sure that you're taking care of it and making these lifestyle changes to take care of it.
Exactly. Not only do we require the addition of immunosuppression, and that's where the big education comes for our recipients, but you also have to really kind of push in and helm that, again, the organ quality that you get and you're able to maintain also deals with your overall health.
Yeah, absolutely. Okay. So with the John C. McDonald Transplant Center, what is the big thing? Like, so you're new to this center, but like you said, you're expanding, and Northwest Louisiana is just kind of a great place to be as far as like if you need a transplant, like this is the place to go. So what do you kind of see for the future now that you've been here for a couple of months and you're planning and obviously very enthusiastic about the future?
Yeah, we are really expanding. I want everybody in the community to know that if you're previously turned down at our institution, please reapply. We are constantly reviewing all of our applications for our recipients, for all the dialysis centers out there. Please keep the referrals coming so that we can help advance our area here. The big area that we've advanced for this year alone is that with the type of procurement that I do, which is normothermic regional perfusion, it allows for what used to be a marginal candidate for being a donor. We have now opened that donor pool back to Northwest Louisiana. So we're working extensively with Louisiana Organ Procurement Organization, or also LOPA. They have been very nice and very accommodating to us so that we can continue expanding. So one thing that we've really honed in is being able to keep our donors local into our area so that we are able to provide our local recipients with organs, specifically with liver. So our liver growth has really kind of been very astonishing for the last 3 months.
Okay, yeah, good deal. And that's exciting because you get to help more people.
Yeah.
Right, and I mean that's your mission and your passion. I almost said mission and passion. There we go.
Yeah, so a lot of other things are happening that is forward thinking. So not only are we working with our recipients and being able to get them on our transplant list, but us as a center continues to grow. So we have a new transplant nephrologist. I know a lot of people in our community knew Dr. Singh and very well. He did move on with us, but we have Dr. Anand Faruqi, who came to us from Columbia University in New York City, who brings a whole vast of knowledge of how to work at a big transplant center. He's young and energetic as well. You have the three new transplant surgeons of Dr. Choi, Dr. Crane, and myself working under the guidance of Dr. Zabari, who has just 30 plus years of experience. You just cannot hold that and take that for granted when you're training and really kind of growing this area. So we're able to be a little bit more aggressive, but yet we have a very big deal about making sure that our quality of our grafts are very high, because we do not do as many transplants yet as are some of our competition. But I want everyone in our area to know that there's really not a difference if you come to us versus other transplant centers. Just give us a shot.
Yeah, absolutely. Yes. And like you said, if you've maybe been turned down before in the past to reapply and because of that expansion. So just because that was a no maybe a couple years ago doesn't mean that, there aren't other options for those people right now. So now talking, kind of switching gears for a second, living donors, and have you worked with, working with kidney and liver? Is that still a possibility for people to be living donors for liver and kidneys at this point?
Yeah, so our living donor kidney program is up and running, has been, and it's one of the longest organ transplants that they've done here. It comes in waves because it really depends on the community and who's willing to be a donor. So to kind of speak a little bit about donation here, a living donor is the ability to take a kidney from from the donor and just kind of walk it across to another OR in real time and give it to the recipient. So there's minimal cold time on these organs. We make sure that both the donor and the recipient go through a pretty big workup. So as a donor, do be prepared, because as a transplant surgeon, I would not want to do anything to harm you, such as take one kidney from you and then you end up on the kidney transplant list, even though there are protections out there for if that were to happen. But it's a really good gift that we're able to have. It was a very big program at Cincinnati where I trained, and I would love to be here as well, trying to work with the community and the culture of the area to just really put out there that even if you don't think maybe you would be a good donor, or maybe you don't know someone, there is altruistic donors out there, people that hear about us at church or anything like that who may not have a recipient in place. But if you're willing to be an organ donor, don't worry about that. We can find a recipient. There's plenty on our list that are young and really would need that kind of quality of graft. And that's actually what keeps them on our list longer, because there's not very many young donors to kind of keep these longevities of these grafts. But the living donor kidney is one of the best grafts that you can have. And really, it's a very special process for everybody, both those who are on the donor team and recipient team. We follow both the donor and recipient to make sure everything is okay. And really, we do have strict criteria for the donors, but that's only just so the population can understand that we know you as a donor do not have to have this surgery. So we don't want anything bad to happen to you because you underwent an elective surgery. So we do have some criteria, but again, if you're willing to let us, call our office, let us get some information from you, and it would really work. That is ultimately the best gift that you can give anyone. The living donor livers, I did come from a program that did this, as well as Dr. Crane, But at our center, we would still need to kind of develop this a little bit more. We
Okay,
want to get
yeah.
higher volume with our deceased donors first, have really good outcomes before we have both a donor and recipient on that side. But that is part of, futuristic planning here. Would love to bring that. We're all working strategically on our robotics. Dr. Choi and Dr. Zabari are very, very good at robotic surgery, and that's something that we would want to be able to offer donors, specifically for like living donor livers.
Yeah, very interesting. But we've got the kidney part down. Like that's something that, if you were interested in being a part of that, all they have to do is call you guys. And then, I'm sure it's an extensive process, like you said, to make sure that all the boxes are checked and everything. But so for someone that maybe needs to receive an organ, how do they get referred to you guys, or how do they become active on the waiting list? Like, what does that process look like?
So the process really looks like the initial part is the referral. So for kidney recipients, you can get these referrals coming from their nephrologist that they follow up with, the doctor that manages their kidneys, and then we can kind of review the criteria to see if you can get both a kidney and pancreas. So we'll help with that determination. Your dialysis center can help out as well. For the liver patients, it's really going to be your gastroenterologist. Doesn't necessarily have to be a hepatologist if that's who you don't follow up with, because we understand they're far and few in between because it's so specialized. But you can go ahead and get a referral into us, and we can kind of take over from there. What does the process look like? This is an area, again, that we're growing at Willis Knighton, especially at the John C. McDonald Transplant Center, is that you'll first start off with an education session with one of our pre-coordinators. So I think the terminology to know here is that we have our pre-coordinators and our post-coordinators. So pre means prior to getting a transplant. Then you have our wait list of the coordinators that make sure that you're staying healthy while you're on our wait list and nothing major in your life has happened. And then you have our post coordinators that once you have your transplant, they're the ones that kind of follow you for life, and it's a very special connection. Mm-hmm. So our pre-transplant coordinators actually hold an education session just so you kind of understand what to expect after a organ transplant, and what is it needed from us, and really frailty. We want to make sure everybody's very strong. It's so much better to have a great outcome where you walked into the hospital and you're walking out, not necessarily needing to go to rehab or become any type of debilitated from our surgery alone. So that's what our coordinators are educating on, really kind of keeping your overall health up to date, knowing what immunosuppression you're going to need, how did your life change having an organ transplant. From there, if you screen through, then you'll meet with a medical and surgical physician. So you'll meet with one of our hepatologists or a nephrologist, and you'll meet with a surgeon that actually does the transplant. We kind of go over in those meetings exactly what to expect. So what do we need to know about you, specifically that may change your surgical outcome? What kind of risks you have versus other patients? Transplant is just such a thing that is so tailored to that recipient, and kind of things to expect. Then kind of going from there, you also meet with, we're a multidisciplinary team. So you have financial coordinators, social workers, you have our dietitians, everybody. Like I said, we are a wholehearted group of people that we want to make sure that for our recipients, everything is in line and going well for them overall. So we have an entire multidisciplinary team that meets with you. And then from there, we go to a listing meeting. Used to previously be called selection, but we don't like to select people in or out. We want to try to list everybody, so we really focus as a team in order to list you onto our service, which is a commitment. It's really a commitment to the patient and the transplant center, because our outcomes depend on our recipients. The recipients' outcomes depend on how we do. So it's a very much commitment to one another. It's lifelong, actually.
Yeah.
And then from there, you can, once you're listed, you're on our wait list, which is when we actually actively start accepting organ offers for you. And once we have a match, our coordinators will give you a call. You come into the hospital, and then we have it set up that you receive the organ. And then afterwards, it's a little stringent at first, just until we can get all the medications kind of sorted, and we want to make sure the graft is doing well. You meet with us twice a week, and then after about a month, we kind of start moving that to every week, and then after about every 3 months, every month, and then it's kind of like that for life.
Wow. Yeah. And so the aftercare is really important, like we've mentioned, because you want to take care of this new, I guess you call it graft or new organ, right? And so what are some of those things? First, how does this change someone's life? Obviously, for the better, but then the things that they really should remember as far as taking care of that organ. So of course it's going to change their life in really positive ways, but then, how do they also have to change and adapt to this new organ?
Yeah, so it's a really remarkable, I have so many patient stories that run through my head on those who are young in their 30s, have young kids who are 9, 10, 11, 12 years old, that they're like, I was originally told that being on dialysis, I'll only have about 10 years, that doesn't even get my kids to, a wedding or a marriage or having grandkids, things that everybody really values. And so once you give them the organ and the organ starts functioning and their quality of life can go up from there, a lot of people will receive more energy after a liver transplant, but they really have to adapt to really the immunosuppression and some of our prophylaxis that we use, and that term meaning that we want to make sure that they are not susceptible to any viruses that you or I are able to tolerate. So there's a lot more monitoring with that. So it's more frequent visits with the physician than they're typically used to. But it's also that we can kind of keep everything going and making sure we're monitoring everything for them. Initially, we'll ask that they kind of be very wary about where they are. So, if you want to, I always say, live life to the fullest. It's all about the quality of your life. You can go to church and different events right afterwards, but please wear a mask. You just don't know who's out there who may be coughing, thinking they have allergies, yet they have a virus, and they're just more susceptible to that in the first year.
And so they're on the immunosuppression. That's a medication, and that suppresses their immune system, so that's why they're more susceptible to these viruses, especially probably this time of year. Is that?
Yeah, this time of year it's crazy, because I always say, you have, again, you have all your grandkids, and as much as I laugh, kids carry a lot of germs with them. So it's always something to just be, the first thing grandkids want to do is go up and hug grandma and grandpa and give them big kisses, which I don't disagree with at all. It was always a highlight of my life. But, you have to just sit there and know that you're a little bit more susceptible. I don't like our recipients to feel like they can't go and do things, like they can't go on a plane or anything like that later on. But we're just kind of a little bit more cautious initially right after transplant because one of our induction medications is quite strong. I kind of say, think of it like a chemotherapy in a way. And so it lasts within the system for about six months to a year. So, one of those things that is just one of those, just be cautious, be cognizant. Again, it's all about education. I think that's the fun part about transplant is just that as a surgeon, education and making sure that your recipient, your patient really understands what the change is the biggest part.
And why are they, what does the immunosuppressant do for the patient? Like, why is that an indication or a suggestion or, prescription for them?
Yeah, it's definitely mandatory. So what it does is it just keeps the body from attacking a organ that they're not used to themselves. So we do match things by your blood type. Liver is probably the easiest. It's, your ABO, so are you A, B, or A? O, B, whatever you are, you kind of get matched 1-to-1. Kidneys are a little bit more specific. They're like the sibling that is very picky. So it needs to make sure that it has all of its alleles along with it. So we cross-match every single kidney recipient. But even though we do all these things, the body does recognize that this isn't self. So that's the important part of the immunosuppression. But as I say with most patients, it seems like a heavy pill burden at the beginning, but normally after 3 months, we got to take another chunk out. For some patients, after 6 months, we take another chunk out. And really the forward part and why we rely so much on our medical colleagues is that there's a lot of research going into, are we able to just minimize the immunosuppression down to 1 pill? And then in the kidney realm, there's a new medication, belatacept, which is an infusion every 4 to 8 weeks, depending on the recipient themselves and where they are in the induction course. And this is a medication that you can just come in, get an infusion, not have to worry about your day-to-day medication pill boxes. So that's the thing that I really love about transplant. We're still a new specialty if you really generalizably think about what's been going on. There's so many surgeries that have been done during the Civil War. Transplant was not one of them. So we are adapting and just growing like crazy. That it's really fun to see. The cool part, especially about the John C. McDonald Transplant Center, it's been up and running for so long that it's really interesting. I saw a patient from the 1980s that had one of the first transplants, and the immunosuppression that they are on versus what we use in today's realm is completely different, but it works for them. So if it works for them, if it's not broke, don't fix it.
Right.
But at the same time, it's just so interesting to see over time how much we've grown in maybe 40 years.
That's amazing. Well, and you can find more at John C. McDonald Transplant Center, and also on Willis Knighton, your website. There's a directory. This is Alana Hofmann. If you wanted to get in touch with them, there will be, all those details there as well. And if you wanted to, maybe if you missed this conversation and you wanted to rewatch it, you can find that at ktbs.com/podcast.